Today I have with me Mr. Kephart, and I'm going to teach him about respiratory syncytial virus, or also known as RSV. Him and his wife are going to have a baby in December, so I'm going to teach him about this for my Nursing 305 class. So RSV is when the bronchioles of the lungs get filled with mucus and it causes the child to have trouble breathing. The season for RSV runs from November to April, and that's why I'm providing teaching for him now. The baby can be contagious for 3 to 8 days, and then it normally lasts as long as the virus lasts. You just have to let it run its course. So the symptoms include wheezing, coughing, sneezing, decreased activity, and fever. And then in infants, they might have apnea, which is where they don't breathe. Normally infants don't breathe for 15 seconds. That's normal, but if it's over 15 seconds, then it's important to get it looked at. They might have decreased activity, or they could be really irritable and hard to soothe. So it's important to know these symptoms because RSV and any other problems that children may have breathing are medical emergencies, and they need to seek medical attention to fix it. So to treat RSV, we normally treat the symptoms, but like I said, it's important to know the symptoms because it could be confused with asthma. RSV is just where the bronchioles are filled with mucus, but asthma is when they're constricted and filled with mucus. So for asthma, you provide albuterol, which is a reliever or a steroid, to help open it up, which will do that. But for RSV, it's a virus, and you can't treat viruses, so we treat the symptoms. So we might provide some light suctioning to get rid of the mucus, or some oxygen if the child is having difficulty breathing. If the baby has a fever, we would give them ibuprofen or Tylenol, maybe some Motrin to bring it down. And then if they're dehydrated, we would keep them in the hospital to give them some IV fluids. Now this all sounds pretty scary, but RSV is very common and most children will get it by the age of 2. So now we're going to go over transmission. So for transmission of RSV is through contact. So one of the main things is coughing and sneezing, and then proceeding to touch your face with the unclean hands, or touching surfaces and someone else touches the surface and touches themselves. So it's very important to do prevention of RSV, and RSV can infect the entire family. So if you have a child who's sick, it is important to keep them home. Please do not go out if anyone is sick. So children can bring it home and give to other children if they go to daycare and then they come home and start touching the baby. Don't be afraid to ask people to cover their sneeze or their cough if they're sick. Don't touch your face at all possible, and don't be afraid to disinfect surfaces, anything the baby touches, so the baby's toys, the crib, stroller. And then for your family, you also want to watch touching the doorknobs, table surfaces, and like I said, toys are a really big one. And the most important thing throughout the whole entire virus to remember is to wash your hands. Your hands is what touches everything, and you don't realize it, and then you proceed to touch your face. So to help prevent RSV, we have a little stop sign, and it says, please wash your hands before touching mine. So we give this to parents to put on their baby's car seat, or to clip it to them anytime they go out in public, because everyone wants to see the baby and to touch them. But like I said, all breathing problems in children are medical emergencies and should not be taken lightly. So now another important topic we definitely need to cover, our last one, is when to call the doctor. Pay attention to your baby. Notice the signs and symptoms. So symptoms, you want to see if they're getting worse. So especially the fever. So a fever greater than 101 is when you want to call the doctor. A harsh or persistent cough, wheezing, if they're breathing fast, and then what we call cessatory muscles to breathe, which are signs of distress. So cessatory muscles, if they're flaring their nostrils, if they're using their stomach, the muscles in between their ribs and then their upper chest, like muscles in their shoulders, if they have to bring those up to breathe, and those are all signs of distress in a medical emergency, and they need to be brought in. Nausea and vomiting are a problem. decreased urine output, and you can tell that by how many wet diapers your baby normally has a day compared to what they're having now. Look in your baby's mouth. Is it dry or their lips cracked? That's a sign you need to bring them in. If they're having any trouble eating, drinking, or swallowing, which would lead to decreased urine output, bring them in. We'll give them IV fluids, get them on their way. We covered a lot today, so we're just going to go over real quick what we covered. We covered what RSV is, and it's important to know the signs and symptoms of them. A lot of them are like asthma, especially the wheezing. Watch their muscles if they're having trouble breathing. In infants, watch their respiration, see how they're breathing, see what's going on. For treatment, we treat them based on their symptoms. That's all we can really do. Transmission and prevention, please wash your hands. And don't be afraid to call your doctor with any questions or concerns concerning this virus. We covered a lot, so here's some handouts we normally give to our parents. And if you have any questions, do not be afraid to call and ask.